exclusive report regarding rural psychology. We'll investigate dealing with the ethical dilemmas and complications that often arise in the practice of psychology in remote settings, with exclusive interviews with experts from the field. We'll take you there now with reporter Shannon Payne.
Thanks, Sarah. There are many unique challenges to practicing psychology in rural and remote settings, ranging from establishing a practice to maintaining competence and registration.
However, these are not the only factors in how a psychologist might operate. Psychologists may experience more indirect issues that impact upon the quality of service given. Their experiences, values, religion, and knowledge influence how the psychologist operates. A student who has lived and studied within a rural community has a much greater understanding of the people within these communities and can tailor their services to these needs. A student who has lived in and studied in the heart of Sydney, however, will not have the same experience required to relate to these clients. Likewise, there may also be a discrepancy of values and religion, which cause a rift between the community and the psychologist, also associated with a reduced ability to connect or understand. For example, a woman of Muslim faith working in a community of primarily white Catholic males may have a difficult time relating to patients and may even face prejudice within her town. All factors can impact upon the psychologist's approach and progress with therapy.
To highlight the limited availability of services in rural and remote settings, a psychologist and nurse from rural Australia has provided her expert opinion on what's available in her town and how this causes ethical dilemmas for psychologists.
You have to probably go at least, an hour to Coffs Harbour.
Wow,
Or there's about an hour and a half to Lismore.
Yep.
We do have the Grafton Base Hospital. They have an emergency department, so if we do have anybody who's acutely unwell, they can go into the Grafton Base Hospital. And within the Grafton Base Hospital is actually a teleconference link to a psychiatric registrar or consultant in Newcastle. So that's, and we do have an outpatient department as well.
Okay. And I think
there are some issues around the crisis line that we've got access to as well, which is the mental health crisis line. Sometimes it can take up to an hour and a half for somebody to answer the phone.
Wow, yeah.
So when you've got somebody who's acutely suicidal, it's not always ideal.
Now, as a result, has there ever been a time when you've encountered a patient outside of the normal setting that you see them in, such as at the shops or at the bank?
Yeah, occasionally I do, yeah.
And
it's not really,
is that an issue? No?
Not really,
okay.
no. Very firmly at the beginning. It's a working environment, and they're expected to actually.
Rural psychologists must consider all relevant perspectives when making decisions, sometimes even more so than urban psychologists. Some examples of situations rural psychologists may find themselves in, where all relevant perspectives should be considered, include the potential conflict between the duty of care and the limits of competence, how to handle multiple relationships, working with minimal resources, and the cultural differences between Indigenous and non-Indigenous populations. Statistics collected from the Australian Psychology Workforce Survey in 2008 discovered that only 6.6% of psychologists in Australia work in rural areas. Only 3.6% of psychologists with specialised skills were found to work in rural areas. This small number can lead to psychologists becoming generalised. Ethical dilemmas can arise from such generalising, such as the conflict between the duty of care of a client and the limits of competence of the psychologist. Imagine you're a rural psychologist and a mother brings her young son in to see you. The mother tells you her son has been exposed to a potentially traumatic event and is worried about his well-being. You have not had specialised training with children and have limited experience with trauma. As a result, you feel like you may not be competent in providing appropriate therapy. As the only psychologist within hundreds of kilometres there, you have a duty of care to this young boy. What do you do? Dr. Louise Raufel and colleagues produced guidelines in 2013 for rural psychologists in Australia. They stated that education on rural ethical decision-making needs to be conducted prior to psychologists practicing in rural areas. This is so they can become aware of unique dilemmas that are not as common in urban areas, such as the generalising of psychologists due to a smaller network. In addition, Dr. Raufel and colleagues suggest ethical dilemmas should be discussed in supervision with a senior psychologist. A rural psychologist is often isolated, so this would need to happen via a phone call or through the internet. This is in conjunction with standard B12 of conflicting demands of the Code of Ethics, which states that where the demands of an organisation require psychologists to violate the general principles, values or standards set out in this code, psychologists must consult a senior psychologist. Furthermore, in 2010, Worth, Hastings and Writing Mallon stated that non-maleficence is the most important ethical principle when rural psychologists are faced with dilemmas, such as the mother and the young boy. According to Standard 2.1, competence of the Code of Ethics, a psychologist provides psychological services only within their level of competence. If they do not feel competent, they must refer the client to another psychologist who might be specialised within that area. Therapy programs have also been tested via the internet in rural areas. Kathleen Griffiths and Helen Christensen in 2007 found that internet-based therapy programs are an effective solution for some people in rural settings. However, the research was limited to depressive and anxiety disorders. So, what should a rural psychologist do after considering all relevant perspectives in scenarios such as the one with the mother and her young boy? Of course, you need to use the Code of Ethics, specifically Standards B1, competence, and Standard B12, conflicting demands. A rural psychologist should not provide therapy if they are not competent, even if it feels as though they are the only point of help for a person. And always, the psychologist must seek guidance from the senior psychologist wherever they can. Alexander Robinson is a Sydney psychologist and mental health clinician working for New Horizons. As a psychologist practicing in the city of Sydney, what ethical dilemmas have you faced in the past?
Yeah, I think that my role as a mental health clinician encompasses quite a few, I have to wear quite a few hats. And I have to be quite mindful of that as well, because as a mental health clinician, I'm supporting customers, I'm supporting staff, and at the same time I'm also providing counselling for a lot of our clients, coming to their home, do more care coordination, so a lot of hats. And so one way of trying to sort of manage a lot of this is, other than having a lot of debrief sessions and discussion, and is putting boundaries and being very clear from the start. Not only that, but apart from just having clear boundaries, but also about sort of talking to customers, talking to staff about any issues that may arise. I think the most important thing of how I deal with ethical dilemmas is boundaries. You have to be very clear with those boundaries, and always just touching upon and talking with people to ensure that, you know, conflict of interest, that, you know, that these boundaries are keeping people safe. You know,
absolutely. Do you feel you have adequate access to resources such as a diverse team of health professionals, training courses, and senior psychologists for supervision?
Yeah, so there's once monthly we have clinicians or a meeting with the specialist advisory team, and there's a psychologist there. As well as that, this is more for supervision rather than training, but definitely New Horizons has in-house training as well. Mental health aid, assist, you know, suicide, a series of other in-house training as well. But apart from that, I just recently did a 3-day training with Marcia Linehan, so DBT, learning about DBT skills. So yes, I think that if it's something that I felt that I needed, my managers and New Horizons has been very sort of open to me sort of, yeah, for professional development. But other than that, I mean, you know, in regards to supervision, apart from having our monthly meetings with specialist advisory, we also have this Mission Australia has once a month meeting with Dr. Berry, who's a neuropsychologist who does supervision, and questions and discussions always come up, and quite interesting questions. And especially sort of very interesting questions around things like, because this is a recovery-oriented practice, the idea of recovery-oriented practice and then that sort of dialectic of duty of care, and that sort of difficult sort of that all of support workers and we are faced working in this sort of environment.
Fantastic.
There are many considerations for psychologists practicing in rural and remote settings compared to metropolitan settings. A common consideration raised by Dr. Louise Raffel is the high demand due to limited specialist and support services in rural and remote settings. For instance, Dr. Raffel claims that there are approximately just 0.83 psychologists per 10,000 head of population in remote areas compared to 5.92 psychologists in major cities. A limited range of services can compromise the professional competency of psychologists who are pressured to go beyond their training as opposed to referring onto a specialist. For example, there could be just one therapist in the community having to rely on self-taught education for treatment techniques which may lack supervision and consultation. A second example may also consider psychologists recently finishing their formal training but are without access to professional development and networking as well as supervision. Without these support networks and further development, the competency of the early career psychologists may be threatened by symptoms of burnout and stress which are known to impair competency. A limited amount of specialists and other service providers can also mean that the psychologists may not be able to be treated for issues such as burnout and stress. The second consideration for psychologists in rural and remote settings is the impact upon their lifestyle and well-being where they could be the only psychologists available in the area. The ethical guidelines for rural and remote settings by the Australian Psychological Society, or APS, suggest that a lack of anonymity can be the result of having just one or few psychologists in the small-sized communities. Furthermore, this can lead to the community's extensive knowledge of the psychologist's social and personal life, which could affect privacy issues and raise possible anxiety. For example, a psychologist may struggle with high visibility whilst going shopping or walking down the main street, which could cause potential boundary issues. And another example can be the problematic or just awkwardness of post-therapy relationships that can be manifest in settings such as club sport or other leisures. However, community knowledge of the psychologist may reap advantages in the form of greater community awareness of mental health care. Furthermore, the psychologist may gain an insight to the improvements of their own clients in public activities or the context of the problems that clients seek treatment for. The third and final consideration for psychologists in rural and remote settings is the nature of who their clients are. For example, a client may be Indigenous, which requires the psychologist to be culturally sensitive and have an understanding of certain customs. Another example involves a client with a neuropsychological disorder, which could be outside the competence of the psychologist and requires consultation with a neuropsychologist in metropolitan settings. Again, the ethical guidelines for rural and remote settings by the APS also raise the issue of who the clients are, revolving around professional boundaries where multiple relationships can be present. The APS informs that these relationships are often difficult to avoid in rural and remote communities and that they can arise from existing relationships. For example, relationships with a patient who may be the psychologist's son or daughter's friend or friend's parent.
Multiple or dual relationships can often be unavoidable for a psychologist in a rural setting. Joseph Scopolitti and colleagues in 2009 found there to be a lot of information on decision-making when entering dual relationships, however limited resources on how to handle these relationships when unavoidable were present. When entering multiple relationships, boundaries must be instilled early on and revisited on a continual basis to ensure the psychologist practices in an ethical manner. Gagne, Wright and Earl Kokowski in 2014 published research that summed up the complexity of multiple relationships to be caused by the large variety of contributing factors. This included the nature of the relationships as well as the benefits versus the detriments. They emphasized the unavoidability and concluded that context of therapy should also be heavily considered when making the right decision. Multiple relationships are an ever-present potential ethical dilemma for rural psychologists. Research has suggested that they can be unavoidable in rural areas and that there are many factors and perspectives to consider when making the right decision. Standards A2 respect, A5, confidentiality, and B3, professional responsibility of the Code of Ethics are just some of the important standards that would need to be considered when entering unavoidable multiple relationships as a rural psychologist.
Psychologist Julia knows of the ethical issues that can arise when counselling in rural areas all too well. Spending the majority of her life in Sydney, she moved to a small rural town where she will begin her career as the only clinical psychologist in her area, bringing her 15-year-old son with her. Julia found herself facing her first conflicting issue regarding her career and her personal life when a party at her house for her son's birthday found her face-to-face with a client of hers, unbeknownst to her son who had invited him over as a friend. Julia was unsure how to handle this predicament, particularly because she was unable to disclose to her son that his friend was her client.
Hi, Julia?
Yeah, Justin's mum.
You're Justin's mum.
Yeah,
Okay.
yeah.
Let's fit the bottle.
Okay.
Do you mind, whilst they're playing, maybe if we had a bit of a chat?
Yeah, definitely. Come through.
Okay,
Come in.
thanks.
It became apparent to Julia that the mother found the situation quite uncomfortable when picking up her son. She had previously emphasised that having her son seek treatment was already difficult for her, as her family had been brought up to be quite self-reliant. A discussion emerged where the client's mother then began to disclose that she herself had been thinking of seeking treatment to resolve issues related to her marriage and family. Julia, having no experience in couples and group counselling, now faced issues where she felt incompetent to provide treatment to the client's mother and faced possible engagement in dual relationships due to her son being the client's friend.
In some instances, therapists and their clients can come up with relatively straightforward ways to avoid or approach different ethical issues. When managing boundary issues, for example, a counsellor whose client works for the only electricity company in town might emphasise and explain why it would be beneficial for one of the client's colleagues to handle visits to the home instead. However, there are often situations in which the potential boundary issues are more difficult to avoid. In my particular circumstances, I had no real choice to continue providing counselling services to both the client and the client's mother, as I was the only therapist in the area and therefore could not refer them on. I approached the boundary issues as early in the relationships as possible and discussed reasonable ways of handling potentially awkward circumstances in a manner that we all found comfortable and which protected us also. I also explained that this circumstance had a high rate of occurring due to the small community in which we all lived in, and taking the appropriate steps to avoid any boundary issues was the next thing to do. I ensured to both clients confidentiality would remain regardless of the client and my son being friends, but emphasized the importance of the client and myself in keeping professional and distant outside of therapy. This meant they would be persistent in engaging in their friendship in other more appropriate settings than my house, and in situations and events I was not an active member of. I made a conscious effort to also document all of these conversations to demonstrate my sincere efforts to handle the situation responsibly and ethically. As I did not feel confident in providing both couples and group counselling to the family, I sought information online and through research articles to develop skills in these areas. It is extremely important as a psychologist in a rural setting to have broad knowledge in all areas of therapy, as there is a high chance situations like this may occur. This is because there is a large diversity of clients that are seeking treatment. Of course, I also referred to my supervisor back in the city for their help and opinions, and I was lucky enough that they were able to supply me with further resources to expand on necessary counselling techniques to ensure I was competent in the therapy I will be providing.
Real-life case studies emphasize how ethical dilemmas in rural areas can occur when practicing psychology. Health services are an essential requirement for these remote communities, and the importance of highlighting possible issues regarding boundaries, dual relationships, competence, duty of care, their clients, and conflicting standards, as well as how to manage these problems are crucial. Sarah Stewart, 20 Minutes.
And from all of us, good night.